Have you ever looked at your blood test report and felt a quiet wave of fear rise inside you, as if those numbers were whispering something about your future that you were not ready to hear? For many living with chronic kidney disease, a simple lab result can feel heavier than it should, turning ordinary medical terms into sources of anxiety and doubt. Yet the truth is that these numbers are not your enemies. They are signals, guides, and silent messengers inviting you to understand your body more deeply. Creatinine, eGFR, and BUN are not just technical words printed on paper. They are reflections of how your kidneys are working every single day to protect your life. When you begin to see your lab report, not as a verdict, but as valuable information, something powerful shifts within you. Knowledge replaces fear, awareness replaces confusion, and confidence begins to grow where uncertainty once lived. This transformation does not happen overnight, but it begins the moment you decide that you will no longer be intimidated by medical language. Instead, you will learn it, understand it, and use it to strengthen your journey. Chronic kidney disease is not defined solely by decline. It is also defined by resilience, adaptation, and informed action. Every test result is a snapshot in time, not the final chapter of your story. Creatinine levels show how well your kidneys are clearing waste from your bloodstream. Estimated glomerular filtration rate, known as eGFR, offers insight into how effectively your kidneys filter toxins. Blood urea nitrogen, or BUN, provides another piece of the puzzle, revealing how your body processes protein waste. Together, these markers create a picture, and that picture becomes clearer when you understand what you are looking at. Dr. Matthew R. Weir has long emphasized that patient education is not optional, it is essential. When you understand your numbers, you reclaim a sense of control that illness often tries to take away. Instead of passively waiting for someone else to interpret your health, you become an active participant in your own care. This mindset does not eliminate challenges, but it changes how you face them. It reminds you that information is empowerment, and empowerment is strength. Many people assume that medical knowledge belongs only to professionals, but your health belongs to you. Learning what creatinine means does not require a medical degree. It requires curiosity and the courage to ask questions. Understanding eGFR does not demand perfection. It demands willingness to grow. Interpreting BUN levels does not require fear. It requires perspective. When you begin to connect these numbers to your daily habits, your nutrition, your hydration, and your lifestyle choices, you start to see how interconnected everything truly is. This awareness can be deeply motivating. It encourages you to take small but meaningful steps, knowing that even minor improvements can influence long-term outcomes. Every lab report then becomes less of a threat and more of a checkpoint, showing you where you stand and where you can improve. There is strength in facing reality with clarity rather than avoidance. There is dignity in understanding your condition rather than denying it. And there is hope in recognizing that knowledge gives you the power to act wisely. Chronic kidney disease may change certain aspects of your life, but it does not remove your ability to learn, adapt, and persevere. The more you understand your blood tests, the more you realize that these numbers are tools designed to guide you, not to define you. In this journey, confidence is built step by step, result by result, and choice by choice. As you continue to examine these numbers, you may begin to notice something deeper than statistics and medical terminology, something that touches the way you see yourself and your future. At first, lab results can seem like distant measurements produced by machines, detached from your emotions and daily experiences. But gradually, you realize that each value is connected to your habits, your discipline, your patience, and your willingness to care for your body, even when progress feels slow. Creatinine is not merely a chemical compound. It is evidence of how efficiently your kidneys are removing waste from your blood. When its level changes, it does not automatically signal defeat. It signals the need for attention, adjustment, and sometimes renewed commitment. In the same way, eGFR is not just a percentage or stage indicator. It is a reflection of filtration capacity, a reminder of how much work your kidneys are still accomplishing every single day. Even when the numbers are not perfect, they often reveal that your body is still fighting for you in quiet, consistent ways. BUN, too, becomes more than an abbreviation once you understand that it represents the balance between protein metabolism and kidney function. When you connect these insights to your choices, your perspective shifts from fear to responsibility. You begin to ask yourself what small action you can take today that may influence tomorrow's results. Perhaps it is drinking water consistently, following dietary guidance carefully, taking prescribed medications faithfully, or simply reducing stress where possible. These actions may seem simple, yet they carry profound significance because they align your daily behavior with your long-term well-being. There will be moments when the numbers do not improve as quickly as you hoped. There will be appointments that leave you unsettled, and evenings when uncertainty feels heavier than optimism. In those moments, it is easy to allow discouragement to whisper that your efforts are meaningless. But this is precisely where resilience is formed. Growth often occurs quietly, beneath the surface, long before it becomes visible in measurable ways. Dr. Matthew R. Weir has consistently highlighted the importance of understanding kidney health as an ongoing journey rather than a single event, and that mindset invites patience. When you embrace the process, you begin to see that stability itself can be a victory. Maintaining your eGFR for months or years is not something small. It is evidence of consistency. Preventing rapid increases in creatinine is not accidental. It often reflects deliberate choices. Even managing BUN within a safer range can indicate balance in nutrition and hydration. As you absorb this perspective, you start to realize that knowledge removes the mystery that once amplified your fear. Instead of imagining worst-case scenarios every time a lab report arrives, you approach it with curiosity. You review the trends, compare previous results, and look for patterns rather than isolated numbers. This habit transforms anxiety into analysis and helplessness into informed awareness. Over time, confidence grows not because the disease disappears, but because you understand it more clearly. And with understanding comes a sense of partnership between you and your healthcare team. You are no longer a passive observer waiting for explanations. You are an informed participant capable of asking meaningful questions. This participation strengthens your sense of agency and restores dignity to your experience. Chronic kidney disease may challenge your body, but it does not diminish your intelligence, your courage, or your capacity to learn. When you choose to understand creatinine, eGFR, and BUN, you are choosing clarity over confusion. You are choosing strength over surrender. Most importantly, you are choosing to face your health with open eyes and steady determination, trusting that informed action, repeated consistently, can shape a future defined not by fear, but by empowered perseverance. There is a quiet turning point that happens when you stop seeing your diagnosis as a sentence and start seeing it as a responsibility, and that turning point often begins with understanding. Many people living with chronic kidney disease carry an invisible weight, a constant background worry about what the next lab report might reveal. That worry can slowly shape thoughts, limit joy, and cloud hope if it is not addressed with knowledge and perspective. Yet the very tests that seem intimidating are also the tools that allow you to move forward with intention. When you study your creatinine level over time, you are not just tracking waste in your bloodstream, you're observing how your body responds to your care. When you examine your eGFR, you are not simply identifying a stage. You are gaining insight into your filtration strength and how it changes with consistency, treatment, and discipline. When you review your BUN, you are not reading a random figure. You are witnessing how nutrition, hydration, and metabolic balance interact within you. This awareness can transform the emotional landscape of your journey. Instead of reacting with panic, you begin responding with purpose. Instead of assuming decline, you begin seeking stability. Instead of feeling powerless, you begin recognizing patterns and making adjustments. The power of this shift cannot be overstated. It is the difference between being overwhelmed by numbers and being guided by them. There may still be days when uncertainty creeps in, especially when a result does not meet your expectations. Suspense often lives in those waiting periods between the blood draw and the conversation with your healthcare provider. During that time, your mind may imagine possibilities that are far more severe than reality. But this is where inner strength must speak louder than fear. You remind yourself that a single result does not erase months of effort. You remind yourself that trends matter more than isolated values. You remind yourself that your commitment to understanding your condition is itself a powerful act of self-respect. Dr. Matthew R. Weir has often emphasized that education gives patients the courage to ask informed questions, and courage reduces unnecessary fear. When you know what creatinine measures, you can interpret changes more rationally. When you understand how eGFR is calculated, you recognize that it reflects multiple factors and may fluctuate. When you are aware of what influences BUN, you can consider hydration and diet before assuming the worst. This depth of understanding allows you to approach appointments, not with dread, but with thoughtful curiosity. You begin to see your healthcare provider as a partner rather than an authority whose words determine your fate. That partnership empowers you to engage in meaningful conversations about goals, strategies, and long-term management. Over time, confidence builds quietly but steadily. It shows in the way you review your lab portal without hesitation. It appears in the way you prepare questions before consultations. It strengthens in the way you adjust your daily habits with intention rather than obligation. Chronic kidney disease may remain a part of your life, but it no longer dominates your mindset. Knowledge has reshaped your perspective. What once felt like a threat now feels like a guide. What once caused sleepless nights now inspires proactive planning. And what once seemed like a mysterious code of numbers has become a language you can understand and use. In this transformation, you rediscover something essential: your capacity to grow, even within limitation. Your journey becomes not only about preserving kidney function, but about developing resilience, discipline, and clarity. Each lab report becomes a chapter, not a conclusion. Each number becomes information, not identity. And each step you take toward understanding reinforces a truth that cannot be taken from you: that informed awareness is one of the strongest forms of empowerment you can possess.